What's up? I'm Ross, and it looks like United Healthcare has gotten caught with their pants down. They may have, it sounds like, it seems like they've had to pay hackers $22 million. Let's get into the story and find out why.
Professionals in several states tell CNN they're still dealing with the fallout from a major cyber attack. Now, the hack disrupted insurance processing at pharmacies across the country a little over a week ago. It targeted Change Healthcare. That's a unit of health insurance IT giant United Health, which processes prescriptions and billing for tens of thousands of pharmacies nationwide. For more on this, we have Molly Smith, Group Vice President for the policy at the American Hospital Association, and Amit Yoran, Chairman and
I just want to hop in here. It's only a matter of time. Every place is vulnerable. There's no place that's not vulnerable. There's no place where your data is going to be safe. There's no place that's unhackable. It's only a matter of time before your data gets shared. Now, this is an insurance company. They're not, I don't think, at least I didn't read any stories, they're not saying what they lost or how much data or what kind of records they lost. But it's only a matter of time. It doesn't matter what entity it is, what you're into. It's only a matter of time before they get hacked.
CEO of Tenable and the former director of U.S. cybersecurity at the Department of Homeland Security. Molly, I want to start with you on this really incredible story. What are the impacts your systems are seeing right now?
Yeah, absolutely. First, thank you so much for having us. This is just an unprecedented attack on the entire U.S. healthcare system. And what our members, hospitals, and many of the doctors, nurses, and clinicians that are working in them are experiencing is that it is hard for patients to make appointments, to get prescriptions. It's hard for hospitals and doctors to actually check and make sure that their patients have insurance coverage and then be able to know how much they may need to pay for the services that they're getting. And then for hospitals and doctors in terms of
So you heard it there. She's saying it's hard for them to get their prescriptions. They can't get the billings into the insurance companies. And this, to be clear, this is a ransomware attack. So if you don't know what ransomware is, it's where the hackers take over the system and then they lock everything out. So they say, hey, you've got to pay us money and we'll unlock your system. So that's what happened to Change Healthcare, which is a subdivision of United Healthcare.
Their cash flow, they are really hampered from being able to send bills to health insurers and then have those health insurers pay them back. So while the impact...
Yeah, so it's a big deal. They can't get reimbursed for their money. So this is putting a wrench in all of the insurance companies, not just Change Healthcare, but the people that they're supposed to be billing and the people that they're supposed to be reimbursing. Anybody that is flowing money through Change Healthcare right now, they're having difficulties thanks to this ransomware attack.
Impact really varies depending on how much a hospital or doctor's office works with Change Healthcare. All 6,000 hospitals and many thousands of provider practices are really feeling the pain of the crunch in their cash flow, which makes it hard for them to make payroll, to buy the medical supplies that they need. So really, this is just an unprecedented challenge that we are experiencing.
And she said it makes them hard to make payroll. So this is actually affecting some folks' salaries, folks that didn't have anything to do with this. Clearly, Change Healthcare or United Healthcare, whomever, did not take the proper precautions and have the proper cybersecurity plan or recovery plans in place, and they're clearly hurting. As I'll show you later, it looks like they paid out this ransom. Let's continue.
Amit, can I ask you, do we have any idea who is responsible for this cyber attack?
So this guy is a cybersecurity expert from Tenable, which is a cybersecurity company. This is what he does, cybersecurity. He sells cybersecurity. So it's in his best interest to, well, obviously this is pretty bad, but what I'm saying is he makes money selling cybersecurity tools. Just know where you're getting the information from.
We do. It's currently believed that an organization known as Black Hat, a group of hackers, Russian-speaking hackers, is the group behind this. And that's the same group that we saw just a short while ago going after and disabling systems at MGM and disrupting their operations.
So these guys just hit MGM, and I was watching a video earlier that says these are the same guys that did the Colonial Pipeline thing, or at least the core, or they think there is some connection between the group that did the Colonial Pipeline thing and this organization, who coincidentally just roused MGM not too long ago. So these guys are on a rampage. These guys are, they're doing well.
I mean, following up on that, what are the long-term effects of a cyber attack like this? And how long does it usually take to, clean up the mess after it's already been done?
Yeah, well, it could take, and as we're seeing in this case, and as we've seen in many other cases, if you don't have your systems properly protected, if you aren't prepared for these types of attacks, it could take, and it is taking weeks. It's believed that Black Hat has had access to change systems for over 2 weeks now, and the disruption continues and continues to get worse for those patients, for those pharmacies that are unable to get healthcare insurance coverage for critical medication. And by the way, that includes pharmacies for the American military hospitals around the world.
They think that these folks have been in the system. They've been in their system for 2 weeks now. 2 weeks. 2 weeks. And it's ridiculous. So clearly they didn't do what they were supposed to do as far as being able to recover their system. And now they're just trying to pay out the money. So I'd like to go to this other article. I think I'm done with the CNN article for now. But I'd like to go to this other article that is showing why we think that they paid this money out. This is a story out of Wired. Hackers behind the Change Healthcare ransomware attack just received a $22 million payment. The transaction, visible on Bitcoin's blockchain, suggests the victims of one of the worst ransomware attacks in years may have paid a very large ransom. So, and for you, those people that aren't in the know, a lot of people that are just casual Bitcoin, they think Bitcoin is anonymous. Bitcoin is not anonymous. You may not know who owns the wallet, but all the Bitcoin transactions from the beginning, they're all recorded. You can see them all. From every Bitcoin, you can see where it's been paid to, where it's gone. The whole thing is called a ledger, right? So it's all being recorded. So let's get into this article real quick. I'm not gonna read the whole thing. I'm just gonna hit the highlights. Now a dispute, the ransom attack targeting medical firm Change Healthcare has been one of the most disruptive in years, crippling pharmacies across the US, including those in hospitals, and leading to serious snags in delivery of prescription drugs. Now a dispute within the criminal underground has revealed a new development in that unfolding debacle. One of the partners of the hackers behind the attack points out that those hackers, a group known as Alpha V or Black Cat, received a $22 million transaction that looks very much like a large ransom payment. So one of the reasons we even know about this is because these guys betrayed each other. There's no honor amongst thieves, right? They obviously did some work with somebody, and that somebody was supposed to get part of that ransom, and they didn't. So they're spilling the beans all online, right? So on March 1st, a Bitcoin address connected to Alpha V received 350 Bitcoins in a single transaction, or close to $22 million based on the exchange rates at that time. And so that's what I mean. They can see the wallet. They know the wallet's there. They just don't know who owns that wallet. But they can see everything that goes into that wallet. They can see what goes out of that wallet, right? And the feds have become pretty good at tracking down Bitcoin as of late. Now, these people likely have some state actor that's protecting them, or they're in a state where they're probably untouchable, which is why we can't get to them. But all the Bitcoin can be tracked and traced. That's how they know about this. Then 2 days later, someone describing themselves as an affiliate of Alpha V or Alpha 5, I'm not sure what that is, Alpha 5. One of those hackers who worked with the group to penetrate victims' network posted to the cybercriminal underground forum Ramp that Alpha V had cheated them out of their share of the Change Healthcare ransom, pointing to the publicly visible $22 million transaction on Bitcoin's blockchain as proof. So again, they can see these, everybody can see these public transactions, and they're like, yo, these dudes got paid and they didn't pay us. I mean, I guess they're trying to ruin the reputation of other criminals. They're criminal, right? But make no mistake about it, I believe that United Healthcare paid this ransom, or Change Healthcare and whomever's in charge, right? It's a subsidiary of United Healthcare, right? If they've had control of their systems for 2 weeks now, 2 weeks, they're losing all kinds of revenue. They probably at some point said, hey, pay the $22 million, scream, uncle, this is bad publicity, it's bad, let's just make this all go away. There's proof of a large amount landing in Alpha V controlled Bitcoin wallet, and this affiliate connects to this address to the attack on Change Healthcare. So it's likely that the victim paid the ransom. And that was a statement from Dmitry Smilyanek as a researcher for security firm Recorded Future. So again, just one more cybersecurity guy. that's talking about this incident. A spokesperson for Change Healthcare, which is owned by United Healthcare Group, declined to answer whether it had paid ransom to Alfie, telling Wired only that we are focused on the investigation right now. Of course, they're not going to tell you anything. Of course, they're not going to tell you what's going on. They're not going to tell you that they lost your information. They're not going to tell you that the system has been hacked and that they're in control for who knows how long. They're not going to tell you any of that, right? Obviously, it's happening, and you can obviously the payment's been hacked, but they're not going to let you know that. So, at any rate, if you've made it this far in this video, consider giving me a like. If this is not your first time or your first video with me, consider subscribing. My name is Ross. Peace.